Hey everybody, it's Michelle Shields, your staff development coordinator for the Holgate campus. Now we have our final third video about oral care. It's from the Oklahoma Nursing Home Oral Care Project. And at the very end of this video, there will be another video for you to watch that shows you some really great things about what we're talking about in this video. Okay, let's get started. Let's start with our pre-assessment. In those residents who have suffered a stroke, what condition might you find in the mouth? A, toothbrush abrasions, B, ulcers, C, one-sided neglect from paralysis, or D, blisters? And the answer is one-sided neglect from paralysis. Question 2. Which conditions are linked to poor oral hygiene? A would be cardiovascular disease, B would be poor glycemic control, C would be pneumonia, and D would be all of the above. And the answer is D, all of the above. Question 3. Which technique does not help reduce care-resistant behaviors? A, hand over hand, B, bridging and chaining, C, reflection, and D, distraction. And the answer is C, reflection. Number 4, what strategy is helpful for distracting a resident with dementia when helping them brush their teeth? A, leave them alone, B, sing to them, C, be careful, be extra careful, and D, hurry them along. And the answer would be B, sing to them. And our final question, which action may cause a fear response while providing oral care for a resident with dementia? A, smile and look friendly, B, clear environment of clutter, C, turn off sources of extra noise, and D, speak in a high-pitched voice. And the answer is D, speak in a high-pitched voice. Residents who require special care in the resistant resident. What we're going to learn today are strategies for providing mouth care for residents with dementia. I've also included some slides in here on palliative care because I think that is important as well, and strategies for avoiding resistant behaviors and additional strategies. So let's review like we have in the last two videos. Poor oral hygiene is linked to cardiovascular disease, poor glycemic control, pneumonia, stroke, weight loss, pressure ulcers, and hospital readmission rates. Okay, let's start off by talking about dementia. You always want to ask permission before providing oral care. That's really important. It is important to get consent. Remember to introduce yourself and tell them what you're there to do. Let the person participate in their own care whenever possible. We really want to encourage that independence for as long as possible. Often, people with dementia are perceived as being unable to perform their own oral care. However, with some guidance, changes in their environments, or modification to their oral health tools, some people may be able to complete oral care activities by themselves. It's always best to allow a resident to complete his or her own oral care if possible, even if you don't feel like they're really doing a great job at it. It's still important to let them try to do it on their own. Adherence to a daily oral care practice is more likely when the resident participates in their own care. They may need assistance with setting it up, cleaning it up, turning the water on and off, putting on the toothpaste, on the brush. They may also need guidance in the mouth with brushing and may need verbal cues to rinse and spit. And it's also really important to set up a routine time and a place to provide oral care. So if you always do it at the sink, then we need to make sure that's in the care plan so everybody does it at the sink. If it's best if the patient's sitting on the side of the bed or in a chair, then everybody needs to do that the same way. That's really important for them. Residents' oral care supplies, you want to keep them in the same place. Make sure everything is labeled, resident's name, and their product name. So they're saying that you should write Jane Doe toothpaste, Mary Campbell toothbrush, things like that, because it's a visual cue for them. How to prevent the fear response. You want to smile. You want to lower your tone of voice. I do tend to speak, as you can tell, kind of in a higher pitched voice. So I always lower my tone, and that helps. Speak slowly and clearly. Ask only one question at a time and provide only one instruction at a time. Don't overwhelm them, for sure. Use non-verbal cues such as smiling, gentle touch, or having the resident hold their toothbrush while you set up the supplies. Also, always use a positive approach. Start by showing the resident what to do, and then coach and encourage them through each step. Give lots of praise, lots of positive reinforcement. You may have to distract the resident in order to provide oral care, and we're going to go through some of that in a few other slides. But helping, it may help to sing to them, or count, or provide the resident with a toothbrush or a face cloth to hold while you're brushing their teeth or dentures. Approaching the resident, you want to always ideally do it from the front and at eye level. While the ideal position providing oral care is to stand beside or slightly behind the resident, it may not be appropriate when providing care for someone with dementia. Because their peripheral vision may be impaired, positioning yourself beside or behind the resident may make them nervous, confused, or uncomfortable. Position yourself in front of the resident to provide oral care. If the resident is sitting, approach them at eye level to appear less threatening. So here's a few techniques for providing oral care for somebody with dementia. One would be the hand-over-hand technique. So the hand-over-hand technique allows the resident to feel as if they are providing their own care. The care provider places their hand over the resident's hand and guides them through the brushing procedure. The next one would be chaining. Chaining goes a step beyond the hand-over-hand technique. When a care provider starts the oral care procedure, and then the resident takes over and finishes the process. This is referred to as chaining. The care provider can place toothpaste on the toothbrush, put it in the resident's hand, and assist the resident to place the brush in their mouth and brush their teeth. The next one would be the distraction method. The distraction method is used to distract the resident during oral care. The care provider can sing, hum, talk, or gently touch the resident. If the resident is grabbing at things with their hands, give them a face cloth to hold in each hand to keep them busy. And once the care provider feels the resident is in control of the procedure, they can let go of their hand and allow them to finish brushing on their own. The next one would be the bridging technique. Bridging is a variation of distracting. Bridging occurs when the resident is asked to hold the same object as the care provider, such as a toothbrush, and then holds the object with oral care while oral care is being performed. And then the last one would be rescuing. When a care provider is experiencing difficulties with a resident, it may be necessary to for the second care provider to relieve the first care provider. So the resident is told that the second care provider is there to help. This may encourage the resident to like and trust the second care provider, and the second care provider will then take over the oral care procedure. That usually works too. Other special care considerations would be palliative oral care, strokes, Parkinson's, and arthritis. So with palliative oral care, our objectives are always to manage oral pain, maintain comfort, and promote dignity and self-esteem. Palliative patients are particularly susceptible to ulcerations, infections, dryness, and coatings affecting the mouth tissue. They are also at a higher risk for tooth decay. These are all sources of oral pain and discomfort. Oral pain can be devastating. It affects the patient's ability to eat and speak. It is important to be diligent in providing oral care and evaluating oral care needs on a daily basis. Oral health problems can develop very quickly and result in rapid deterioration of the patient's overall health. Having a clean mouth free of unpleasant odor may also improve a patient's self-esteem and sense of overall well-being. Common conditions, we've talked about these before in I think maybe the first or the second video, I can't remember, but one would be dry mouth, cracked lips. The cause is often chronic dehydration, sometimes medications, genetic disorders, diabetes can be one. Mouth breathing can also lead to a really dry mouth. So the symptoms would be difficulty swallowing, chewing, and sometimes even speaking. It can also cause bad breath and hoarseness. And a dry mouth is an optimal breeding ground for plaque and bacteria. This can lead to increased tooth decay, gum disease, and burning mouth syndrome. Treatment, that really depending on the severity, treatment of dry mouth can be as simple as increasing fluid intake by drinking water or sucking on some ice chips whenever possible. Monitor fluid intake to ensure that the patients are not at risk for dehydration. If it's appropriate for the patient, you can do sugarless candy or sugar-free gum can increase saliva production in the mouth. Dry mouth products include toothpaste, rinse, saliva substitutes are available commercially, and we can get those just getting a script from a doctor for those or calling their dentist. Also, something that I've never really seen issues here, but a room humidifier may also be useful to moisten the air for mouth breathers. So that is an option that we can look at as well for palliative care for a patient. The second one would be thrush. We've talked about this as well. Fungal overgrowth occurs on soft palate, gum tissue, and tongue. The causes, it is likely to occur when the body is run down. Patients who are on antibiotics, immunosuppressed, receiving chemotherapy, or diabetics at the high risk for this type of infection. If dentures remain in the mouth for extended periods of time, underlying tissues are not able to be cleansed naturally with saliva or other brushing and rinsing. Dentures should be removed daily for cleaning and to allow mouth tissues to rest. Dry mouth and certain medications can also trigger thrush. Symptoms: white creamy patches or small red dots. It's usually not painful, although sometimes the underlying tissue is raw and may even be bleeding, and that is painful. Treatment with an antifungal agent is possible, but must be prescribed by their doctor. You want to disinfect or discard any oral care tools that were exposed to the infected tissue. That's important. You can also soak dentures in a solution of vinegar and water to eliminate any cross-contaminations. Dentures that do not contain metal can also be disinfected by soaking them in mild bleach solution. I think it's 1 to 15. So 1 part bleach to 15 parts water. I would probably, if it were me, want to use like a vinegar or water solution. But just using like a tablet is not going to kill that yeast on their dentures. Number 3 is angular cheilitis. I always have to think about how to say that. It's a chronic painful condition that occurs in the corners of the mouth. You've probably seen this and didn't know it was called cheilitis. Causes: it's often seen in people who have lost some of their some or all of their teeth. They're constantly licking their lips. Drooling or pooling of saliva often causes angular cheilitis. Poor nutrition and fungal or bacterial infections can also contribute to this condition. It appears as a red ulcerated patches in the corners of the mouth. It can make it very painful to open the mouth, which can impact eating, drinking, and speaking. Treatment as an antifungal agent and improving overall nutrition can help alleviate this problem as well. So tips for daily oral care. Assess the patient's needs daily, identify risk of any oral conditions, and set a daily oral care plan. Record and report any issues. As we've already mentioned, ensuring the mouth is moist and the patient is hydrated is important for mouth comfort. Remove and clean dentures at least once a day. Ideally, dentures should not be worn while sleeping. Leave dentures out for a minimum of 1 hour each day to allow the mouth tissues to rest. Moisten the denture before placing it back in the patient's mouth. A water-soluble lubricant or a saliva substitute placed under the denture can also improve comfort. The most important goal in providing oral care to palliative patients is really to maintain optimal oral hygiene with a minimum of discomfort. Avoid mouth rinses that contain alcohol because those can dry out the mouth and irritate the gums, and instead rinse with alcohol-free mouth rinses, saline, soda water, or neutral fluoride. Rinse after every meal or use a moist gauze to wipe out leftover food from the cheeks and under the tongue. Do not use oral foam tip swabs. These swabs usually just move the food around in the mouth without actually removing it. And lemon or glycerin swabs should be avoided because they can also have a drying effect on the gum tissue. I can't tell you how many times we used these glycerin swabs or lemon swabs when I worked on oncology. So I'm happy to see that we're no longer using those, or we should no longer be using those. It is best to use an ultrafine toothbrush twice a day with a very gentle brushing or patting action. Firm bristles can tear the gums and that can cause some bleeding. You also want to avoid petroleum-based products for lip care. Petroleum products usually cause tissues to dry out. So apply non-petroleum water-soluble moisturizers to the lips 2 to 6 times daily as needed. You can also start saliva substitutes 2 to 6 times daily, may also help keep the mouth moist as well. Stroke may cause problems with vision, hearing, and remembering, thinking, and understanding others. A stroke can cause paralysis of the face and mouth, resulting in one-sided neglect. Stroke, Parkinson's disease, and arthritis can make brushing difficult. So using child-sized toothbrush heads for residents who have trouble opening their mouth can also help. And the last thing is starting this video. So you want to watch this last video, complete the quiz, and you've completed the 2 hours of oral care. So that's your May and June education, mandatory education for May and June. So start this video and you're good to go.
Let's take a look